away for us in just a tick, but today, Sunday the 29th of September, is World Heart Day, and to celebrate, a North West volunteer group has been highlighting its achievements to support people born with congenital heart disease, or CHD, and their families. The group is called the PPV Group. We'll find out more about the name and what they do. And they're having a little call out for new volunteers to help drive its vital work forward. And joining me now is Claire Cathcart and Janet Rathburn to tell us more. And please be aware that some parts of this conversation may be upsetting for some people, of course, as we talk about this. Welcome along, Claire. Welcome, Janet. Great to see you. So first of all, Claire, we come to you. Tell us what PPV is.
So PPV is the Patient Public Voice Group. We're a group of volunteers. We formed just before COVID started, and we're basically trying to be the voice of the cardiac patients for paediatric patients and grown-up adults with CHD as well.
I gave a statistic there. Did I read that earlier? No, I read it earlier. Every 2 hours, a baby is born with a serious heart condition.
Yep, that's true.
Wow, we're talking about holes in hearts, murmurs, not formed fully.
That's right, a whole range of conditions. There really is a whole raft of them. And like you say, 2 children born every hour, 2 babies every hour. So, and as you've just alluded to, although surgery has improved dramatically over the last few years, sadly some children still do die. But thankfully most children don't go on to recover and lead normal lives, but will need lots of support and care, probably interventions, possibly more than one lot of surgery as they grow up. So, as Claire's already said, the PPV group is part of the CHD North West network, which covers North West, Isle of Man and North Wales. And our job is to be the public voice, is to be the patient voice, and to make sure that the clinicians, the medical people, know what it's like from the patients and the family's point of view. We're a critical friend, really. It's support and challenge. So if we pick up on something that's not going well, then it's our job to make sure that that's raised.
Would I be right in guessing that the two of you have got a connection for a reason? I'm assuming you've either had heart conditions yourself or had children with heart conditions.
Yeah, so my little boy, Jake, is 9, and he was born with arrhythmia and cardiomyopathy. So his heart didn't pump properly and his heart rhythm was crazy. We didn't know before he was born either. And he spent pretty much the first year of his life at Alder Hey, and then was transferred to Great Ormond Street. Had a couple of procedures, one being on his first birthday, which wasn't the best party he could have had. And then was relatively stable up until the middle of lockdown, when he deteriorated and he needed a heart transplant following mechanical intervention with a Berlin heart for 2 months.
Wow.
Yeah.
So you said cardiomyopathy. If you've got a new heart, do you no longer have cardiomyopathy?
No, he's classed as heart healthy now. He's just a post-transplantation.
Is anybody with you cardiomyopathy as well?
Yes, we've got people who have cardiomyopathy.
Because cardiomyopathy also has another name, doesn't it? Like a later, it's also known as sudden death.
Yeah. Well, it's known as heart failure. Yeah, I guess.
So one of my relatives has got cardiomyopathy. That's how I know about it. But it's the kind of a condition that people don't really know about. We hear about footballers who've died on a football pitch, been perfectly healthy, and it turns out it was cardiomyopathy. That's right. Which is why they call it the sudden death syndrome almost. So your son's doing well.
He is. He's great. Yeah, coming up for 4 years post-transplant now. So we don't actually see a lot of hospital as patients at the moment. He goes to London for his follow-ups, and in between that there's a follow-up at Alder Hey as well, which is our local level 1 heart centre.
I recently hosted an author event with a lady called Dr. Rachel Clark, who has just written a book about heart transplants, very famous case. It's called The Story of a Heart, and it shows transplant from one side to the other side, and you'd enjoy it.
One of Jake's nurses actually wrote a kids' version of a heart transplant book, and it's dedicated to Jake and another heart patient, Tyler, as well.
That's amazing. It's incredible. I'm so pleased to hear your great news story. Janet, tell us about your story.
Well, mine is a good and not so good news story. My daughter is in her 40s now, so I've been involved with cardiac congenital heart conditions for a very long time. Sarah's got Fallow's tetralogy, and she, a little bit like Jake, spent a lot of time in hospital when she was a baby. She had her first open heart surgery when she was 3 months old. Fortunately for us, Sarah's done really well with all her interventions, and she's had lots. She also had her last surgery in London, so she's done Manchester, Liverpool and London. And we've got great cause to be grateful to Liverpool, because she had her first surgeries at Myrtle Street, which is going back a bit. So Sarah, to all intents and purposes, is fine. She has to have regular checkups. Sadly, she had a little boy who was born with the same condition as she had, and Dominic didn't make it. He died after having surgery, and he was 3 months old. So I've been involved with the scene for far too long, really. But one of the important things that both Claire and I do, because as well as being part of the PPV group, is that we're both part of charities who support families. So Claire's with Team 1C, and I'm with the Children's Heart Association. In the good old days, there wasn't any support, but now there is a lot of support for parents and families, and both our groups do lots of different things to support families and to fundraise and support the hospitals that we're involved with. So it's quite a complicated scene, really. And the thing about heart conditions is that most of it isn't visible. People don't necessarily know that a child's got a heart condition. They generally speaking do if they see the scar running down the chest or whatever. But so that's another reason why we really need to make sure that, particularly on World Heart Day, people are aware of heart conditions. And it's not just congenital heart conditions. That's the thing we're most interested in, but as well, it's adults with acquired heart conditions. And one of the things that John Moores University is doing is to help people to realise how they need to keep the heart healthy and to look after themselves. So that's happening around the area today as well.
And what sort of tips are they giving? Do you know?
Well, it's the things that we all know but don't necessarily do, isn't it?
I love that you said that, Jana.
Exactly.
I mean, I was already warming to you, but now we're at tropical, almost menopausal heat levels here.
Absolutely. So yes, exercise, eating the right things, basically doing everything in moderation.
No smoking.
Really. No smoking, definitely. Like I say, exercise, eating proper food, avoiding the takeaways and the burgers too often, and obviously no smoking. So that's the message that they're getting out. The message that we want to get out is that we need some more help. We need some more volunteers, don't we, Claire?
You've talked about how you're the voice for the paediatric side. So, Claire, when you were going through all of this with your son, who's really healthy now, did you feel that there wasn't somebody there batting for you?
Well, that's why Team 1C exists, really, because when you're in the long term, you tend to make friends with your neighbours in the other cubicles and stuff like that. And our way of coping really was to get Team 1C together, which we started to do as a fundraising thing to help other charities. And then it became more of a, let's support each other. Let's try and make this life in hospital a bit easier. One of the things we do on a Sunday night is we deliver food to the parents, because there's no facility to get food of an evening, and the only time parents tend to leave the child is when they have to, when it's handover. So because we've been there and we've lived that life and we know where the gaps are, we try and fill those gaps and provide support that way.
Well done, you. So tell us how people can find out more about what you do, and if somebody listening says, you know what, I've been through this, I've got sympathies for this, I would like to help, how can they do that?
Well, if they want to get involved with the PPV group, then we've got a website, the Northwest CHD Network at alderhay.nhs.uk. Or if they're looking for more support, if they Google Team 1C or Children's Heart Association, then they'll be able to get in touch with us and, get that support from parents who are very careful not to offer medical advice.
Of course.
Because every case is different, but like Claire says, we know what the gaps are. We've been through it. We can empathise with people.
Because there's this awful thing that when, people firstly always think that it's the easiest thing in the world to get pregnant and to have a child, and that your child will be running around meeting all those developmental milestones along the way. And so the norm is that that's the normal process and the normal path, and all of your friends and your family have followed that path. So it must be horrifically lonely when you're faced with a different version of that story. And that's where you guys come in with these volunteer groups to say, we've done it, we've been there, we're here for you. So it's so vital. Thank you so much on World Heart Day.
Thank you.
Thank you.
And for sharing your stories with us. Give us those details again.
The Northwest CHD Network at alderhay.nhs.uk.
So what's the week look like for you? Do you have like admin stuff or?
Well, like Claire says, we're all volunteers. I'm retired. Claire's still got a very busy job. I'm the chair of the PPV group, so that does involve a bit more. This week is a bit busy. I'm doing drop-in sessions at, because I'm based in Manchester, at MRI on Tuesday and Royal Manchester Children's Hospital on Wednesday. One of our members did a drop-in at Alderhay on Friday, and another one's doing a drop-in at Liverpool Heart and Chest tomorrow. So again, to raise awareness. And then on Saturday, we're having a busy week, aren't we, Claire? It's our... We meet normally on Teams, but on Saturday we're having a face-to-face meeting.
How exciting!
I know.
It's only the second one, isn't it?
Yeah, we had one last year. We've got one this year, so it's very exciting actually seeing people to see how tall or short they are. Because we all look very different, don't we, when we're not on screen? So that's good. And the other thing we do, the group does a lot of things. We've arranged learning days, learning study days for parents and families and patients with congenital heart conditions. So there's a whole raft of things going on. So
the world needs more of you two. Thank you so much for all you do. Thank you for coming in and being so busy at the moment. Big hugs to Jake.
Oh, thank you.
Take care. Thanks for your stories. Bye-bye.